I'm Keith Wages, Director of the Georgia Office of EMS and Trauma, and on behalf of Dr. Pat O'Neill, Commissioner of the Georgia Department of Public Health, and our entire team, I want to thank each of you for participating in this educational opportunity. I want to start by offering a few comments about systems of care in general. All systems of care that we aspire to create have four things in common. We want them to be physician-directed, data-driven, community-based, and patient-centered, or people-centered if you prefer, which encompasses not only the patient itself, but the families of the patient and the responders as well. We have worked diligently across many disciplines in Georgia to establish systems with those characteristics. All effective systems of care have three qualities. One is one or more leaders who provide the guidance and energy for the initiative. In the case of Infectious Disease Network, it was Dr. Patrick O'Neill, Commissioner of the Georgia Department of Public Health, Dr. Bruce Ribner, Director of Emory's Serious Communicable Disease Unit, and Dr. Alex Isakoff, Medical Director for the Biosafety Transport Unit. Another quality that all successful systems have is a network, in our case a statewide network of EMS providers and hospitals working together to be a part of the team and carrying a message forward. And thirdly, the systems of care must have the integration between EMS and hospitals. And we saw that in so many ways in this project, and it is essential that we have that integration.
Good afternoon. My name is Peki Prince. I'm with the Georgia Department of Public Health, Emergency Preparedness, and Office of EMS and Trauma. I am the Infectious Disease Transportation Lead for the state of Georgia. In 2014, Georgia was tasked with developing an infectious disease network. The infectious disease network has two components: hospitals and transport services. We are fortunate in the state of Georgia to have several services step up to the mission and create what is now known as the Georgia IDTN, Infectious Disease Transportation Network. Since 2014, the Infectious Disease Transportation Network has grown and evolved, just as the hospital side has grown and evolved. Within the Georgia Infectious Disease Transportation Network, we have created three levels of courses: an awareness course, an operations course, and a technician's course. Those courses have been the staple of training all of our medics across the state of Georgia within our network teams on how to properly care for an infectious patient. Not only take care of the infectious patient to the highest degree that we can, but also to take care of themselves so they can, in turn, go home to their families with the security of knowing that they will not transfer a disease to their loved ones. As the courses have continued to grow and develop, and the team has continued to grow and develop, we, with the Office of EMS and Trauma, have developed another course, and the course is Infectious Disease Advanced Skills. And this course is designed specifically for our teams or our network across the state of Georgia as a recertification course, as a course that will test the limits of our teams in their processes and their skills. And within the advanced skills, we stress our teams to identify how they would take care of a PPE breach, personal protective equipment breach, how you would take care of a catastrophic equipment failure, something of that nature. That course was started in 2018 and is being offered across the state as well. With the first initial courses, the awareness, operations, and technician course, while they were first developed for the network, through the State Office of EMS and Trauma, those courses are now available statewide for every EMT and paramedic in the state of Georgia. The only course that is now specific for our infectious disease transport team are the advanced skills. One of the major points that I would like to highlight in this section is the difference between a 911 call and then a call between a sending facility and a receiving facility. When you receive a call from a sending facility, the patient will be transported to a level of higher care. You know what pathogen that you'll be dealing with. You know the type of PPE that you'll need. You will have a patient care plan. All of that will be pre-planned and lined out. In a traditional 911 call, however, that is not always going to be the case. It is incumbent upon our first responders to be astute and aware and to ask the appropriate questions and to make sure that that information is relayed as the patient is transferred. No matter how the patient enters into the system, whether it's through your traditional 911 call or the patient enters into any of our healthcare facilities, once the Georgia Department of Public Health is aware of the possible situation and the possible pathogen, please know that you are not left alone. There is a process in place, there is a plan in place to where we will help identify the pathogen and identify the processes of how to take care of that patient. Just as in Georgia, where we have a plan to take care of highly infectious disease patients, there is a plan to take care of patients that may present in one of our other sister states within the region. If a patient presents in one of the other states and needs to be transferred to Emory University Hospital, our regional treatment center, there is a system and process to where we communicate with the sending state, our federal partners, and the state of Georgia, Georgia Department of Public Health, to make sure that that transfer occurs as smoothly as possible. Anytime that we're transferring a patient from state to state, from one side of the country to the other, or internationally, our first choice is to go by air. Our contractor is Phoenix Air, and that will always be our primary go-to. However, depending on the variables, we may have to transport that patient by ground. There is a plan in process of how to do that.
To reiterate, one of the challenges for the infectious disease system of care is sustainability. Continuing education is essential. Continued exercising and practicing and collaborating with all of the engaged partners is absolutely necessary in order for us to maintain continued competency.